Steve, thank you very much indeed. 122,000 coronavirus tests were provided by the British government on the last day of April, passing Matt Hancock's 100,000 daily testing target. Here is the Health Secretary speaking yesterday.
We put a fleet of mobile testing units on the road and created home testing kits. So if you can't get to the test, we can get the test to you.
But are those figures slightly misleading? Do you think the government have got a grip on testing, or are they still playing catch-up? And Kim Jong-un has appeared in public for the first time in 20 days, according to North Korean state media. The KCNA news agency says the leader of North Korea cut the ribbon at the opening of a fertilizer factory on Friday. But can the photographs be believed? We'll speak to somebody in South Korea in just a moment. Good morning, this is LBC.
On your radio, on Global Player, and
Play LBC.
leading Britain's conversation. This is LBC.
From Global's newsroom, I'm Bill Overton. It's reported once the coronavirus lockdown is eased in the UK, we could be asked to check out temperature before leaving home. The Times newspaper says it's one of the ideas the government's considering to try to keep people safe on public transport. The lockdown in Ireland has been extended by another 2 weeks. The country's Prime Minister Leo Varadkar says after May the 18th, though, some rules will be relaxed. Labour suggested the government's claim to have achieved its target of 100,000 tests per day doesn't reflect the facts. The figure now includes home test kits, which may or may not have been used. The government's testing coordinator yesterday insisted there's been no change to the way they're counted. Professor John Newson says the new capacity will be scaled up into a track and trace system.
The 100,000 tests a day target was set for two purposes. It was intended to motivate the programme and set the scale of our ambition, and it has certainly done that. We knew from our calculations that we would need something like this level of testing to be ready for the next phase of the response to the pandemic.
Another 739 people have died with the disease in the UK, bringing the total number of deaths to more than 27,500. US regulators have approved the emergency use of an experimental drug that appears to help some patients recover faster from COVID-19. Results of a government-sponsored study there showed remdesivir, made by Gilead Science, shortened recovery time in hospital by 31%, about 4 days on average. President Trump's spoken to the company's chief executive, Daniel O'Day, in the Oval Office.
Some patients can benefit from only 5 days of treatment, which I think is a real benefit, by the way, for patients to get 5 days of IV, and if they're improving to get out of the hospital, great for them to get back to their loved ones, great for reducing the burden of the healthcare system.
2 leading holiday lettings firms are being investigated over refund policies for customers during lockdown. The consumer group Which says it's had complaints about Ho Seasons and Sykes holiday cottages and their terms and conditions. Both companies insist they're doing all they can to help. It's understood the Premier League remains fully committed to finishing its current season to preserve the competition's integrity. All 20 clubs met for discussions yesterday to look at how matches can resume safely during the current pandemic. And drive-in movies could be the way ahead for the cinema industry to get back on its feet. They've opened in Germany, the Czech Republic and even Iran as a way to watch new films while socially distancing. A 3-screen drive-in in Manchester, which would have opened in late March, said ticket sales showed strong support for the idea. Weather today, showers along with the sunshine in the east, but most of England, Wales and Northern Ireland staying dry and fine. Rain later on for Scotland, with a high today of 18 degrees. From Global's newsroom, you're up to date.
One day, social distancing will be a memory. Flattening curves will be done at the gym, and we'll all be experts in web chatting. Maybe. Until then, HSBC UK is here to help. From contacting those who are most vulnerable to setting aside £8 billion of lending to support our UK business customers. Because you are not an island, you are part of something far, far bigger. To find out everything we're doing to help, search HSBC UK Coronavirus. HSBC UK. Together, we thrive.
This is LBC from Global, leading Britain's conversation with Andrew Castle.
Hello, very good morning to you. It's just coming up to 4 minutes past 7. It's Saturday, the 2nd of May. I hope you're very well. How has your week been? It's a lot colder than it appears to be outside today, but another beautiful day. And are you optimistic or not about the government's testing programme? I don't know whether you saw that yesterday, this Hancock test. He's met it, and some people are a little bit critical of whether or not they've told the whole truth on this and been completely transparent. I think that's a pretty mealy-mouthed response, to be quite honest. I mean, the Hancock test was that whoever needed a test could get one. We've now got over 100,000 tests per day, which is what he was aiming for. And as a logistical effort, surely the government to be congratulated on that. Have the government got a grip on testing now? Do you understand why it's so important? 0345 606 0973. Lots of other things to talk about this hour as well. The South Korean leader will certainly report on that. He's appeared in public, or has he? The Korean state media have said that anyway, as if they're to be believed. But let's get up to speed now completely with what's been going on around coronavirus and COVID-19. Are we finally looking at the other side of this thing? Can we see a way out? Sean Lynch is LBC's reporter. Good morning, Sean.
Good morning, Andrew. Of course, as you say, yesterday was the big day. All eyes were on number 10 to see if Matt Hancock had met the 100,000 a day testing target by the end of April. Now, we've got to say it didn't look likely, and they certainly weren't expected to. It was a huge task that they were trying to deliver. Even the Health Secretary's cabinet colleagues appeared to doubt it. In fact, on Thursday, which was the final day of April, the Justice Secretary, Robert Buckland, suggested here on LBC that the government probably wouldn't hit it.
We'll know the stats in a couple of days, and even if we don't get there today, we're going to get there very, very soon.
But we're not. Can we just? You do use the expression "to be honest." I wonder if you could be candid with me now. We will not have 100,000 today.
Nick, I haven't seen the figures, but we were on 52,000. Even if we don't get there today, I think we'll get there pretty soon.
But it looks like they smashed it, seemingly doubled in just a few days. Matt Hancock said yesterday that 122,347 tests were provided in the previous 24 hours.
This unprecedented expansion in British testing capability is an incredible achievement, but it is not my achievement. It is a national achievement, achieved by a huge team of people working together. And I'll tell you this, the testing capacity that we've built together will help every single person in this country.
Now, as you mentioned, there is confusion, in fact, even a row over this figure. So if you look at the stats put out by the Department of Health, they said just over 73,000 people were actually tested in that time. And now that is still a huge increase, but it's not 100,000. So in the government's figure, they included tests that were sent out on that day to people's homes and to testing sites. So the 122,000 figure includes tests that have been deployed but not actually carried out yet. The UK's testing effort coordinator, Professor John Newson, confirmed at the Downing Street briefing that this was the case. Home testing kits are counted when they're mailed out, not when they're completed. So lots of critics saying the government have changed the rules, fiddled the numbers, and the Shadow Health Secretary calling it misleading, saying the government commitment was to carry out 100,000 tests, not to mail them out. But still, whichever way you look at it, the increase is huge. In fact, last Thursday, only around 28,500 tests were recorded, so it looks like capacity's even quadrupled. Now, yesterday's figures also showed a rise of 739 more coronavirus-related deaths in UK hospitals, but that's now in all settings. We know it's not just hospitals anymore, it's in care homes and people's private homes. So when you look at that figure, last week more than 800 deaths were being recorded daily in hospitals alone. So it does look like we are starting to see that figure decrease, and as we know now, we are past the peak of the virus. So this could be where we start to see some changes. We'll get the Prime Minister's exit strategy, lockdown exit strategy next week. The Times was reporting this morning, one measure being considered is to ask people to check their temperature before using public transport. A senior government source saying that's a long way from becoming policy, though. And the Telegraph this morning writing the 2-metre social distancing rule could be reviewed to help allow more businesses and schools to reopen. So another busy week ahead for the Prime Minister and co. But a lot of critics saying that things like the testing ramp up and temperature checks should have been happening a long time ago.
Charlotte, thank you very much. Charlotte Lynch is LBC's reporter. Elisabetta Grappelli is a virologist and lecturer at St George's University of London. Elisabetta Grappelli, very good morning to you. Where do you stand on testing? Has Matt Hancock, have the government done well on this? Do you feel they have a grip now on where they're going with their testing regimen?
Good morning. So when it comes to testing, I think it has been a challenge for the UK, and there was an initial underestimation potentially of the importance of testing, and I think now, last month on the 1st of April, when the Health Secretary announced the 100,000 tests, that was definitely a commitment to go in the right direction. And that has meant increasing capacity, increasing coverage, and that is what the UK is doing, and that is to be welcomed.
Why is testing so important? I know it's a question that has been answered in the media by the government and everything. Just explain to people just why it is so important to be tested, or perhaps going on into the future to when are we actually going to see a test which tells us whether we've had COVID-19 or not, but the importance of testing.
So at the moment, the importance of testing is actually for the test that tells us if someone is infected. And this is really important because if we know who is infected, then we can target, for example, the quarantine and the isolation to that specific person. So instead of having a society-wide lockdown and quarantine, we can just ask the individuals who we know are infected actually to take one for the team and actually stay at home while the rest of society carries on. But also testing means that we can test the people who, for whatever reason, have come in contact with those positive cases, and therefore we can follow and see where actually the virus is and stopping it in its tracks.
I must ask you, how reliable is this test? People are going to be self-swabbing at home. Is that difficult? We've heard much of these home tests.
I would say it's certainly not pleasant. It's not particularly difficult. I think it's difficult to do it to yourself, but it's possible. You just need to be actually careful about not cross-contaminating actually your samples. So to follow the instructions about using the cotton bud only when it needs to go, which is basically at the back of your throat. It's not going to be pleasant, but there is it's not. We're not asking people to do a blood test on themselves, which actually that will be very challenging.
But there are still lots of false negatives, aren't there? So in that way, that wouldn't help, would it? If you get a test which says you're negative, but actually you're positive, how much of a concern is that?
So the test itself, although obviously no test is perfect, but the test itself is very robust. But obviously, if the sample hasn't been taken in an ideal procedure, obviously that can contribute to a false negative. The important thing is that the test is not a one-off. So it's not that you've had a negative test today. It means that in 2 days' time you're still negative. And so the importance of consistently providing high capacity for testing, and for people who have come into contact with positive tests to actually do the test again, or for people who develop symptoms to do the test again, that's the important thing.
Okay, and can you get COVID twice is another question I saw somebody trying to answer yesterday. Is there new information on that this week? Can you get COVID-19 twice?
So I'm not aware of any stronger, ginormous reports on actually going
No, I was probably trawling around on the internet, like getting information that was completely ridiculous. I mean, there's a lot of stupid information around there because it's not information. There's a lot of lies around us, isn't there?
But I think the science itself still supports the fact that, and actually there is more science, more evidence that people who have recovered from the infection, and actually those people in some countries have tested negative twice, so we're pretty sure that they're negative, and therefore they have the antibodies, so they have the molecules in the blood that actually prevents an infection. The problem is how strong that prevention, that the protection is, and how long it would last. And for this, with a little bit of time.
There's still a long way to go. Thank you very much indeed for your time. Elisabetta Grappelli, virologist and lecturer at St George's University of London. Munira Wilson is with us, health spokesperson for the Lib Dems, MP for Twickenham. Munira, good morning to you.
Good morning.
The 122,000 test figure, some criticism for it because it includes numbers on home testing kits which were not included before. Are you a critic, or are you pleased to see all these tests out there?
Well, undoubtedly, we've seen the government make significant progress through the month of April on its testing programme, but I do think it's somewhat disappointing that the government has had to massage the metrics. I think actually the British public would have been very forgiving if they turned around and said, look, we've made huge progress, but actually we've got to about 72, 73,000 actually done yesterday, and these further tests were sent out. But why not, in terms of keeping public trust and confidence, just hold your hands up and say, we've made huge progress, we nearly got there, these were sent out, and within a couple of days we'll hit the target.
Munira, though, seriously, political opponents would have been all over his backside on this one. I mean, they would have absolutely panned him. There would have been calls for him to go because he hadn't reached his target. So, whilst I applaud your sort of adult view, do you really think politically it was possible for him not to get to 100,000? His job was on the line.
No, I don't think so. Actually, I was asking the same question that you're asking me now a few days ago about honestly thinking he was going to make it. And even then, I was saying, in a time like this, of an unprecedented crisis, it's very difficult for any government of any type, because when it's not a political issue, there's no health emergency. It's very difficult for any government to get everything right. I think the main thing we need to do in a public health emergency is maintain public trust through being really transparent and open about what's going on.
Yes.
So I think actually being open about it, you would get trust from the public. I don't think we have to get keep going. The main thing now is actually rapiding up and continuing to ramp up that capacity so that we can start to think about ending the lockdown by having means programs of testing, tracing, isolating.
And of course, everyone has to sign up for the NHS app that is going to be coming out. When's that coming out? I mean, are we going to be able to trust that? I mean, of course, if we're told to sign up, we should do so, but it's absolutely vital, isn't it? When's it coming out? Do you know?
I don't know when it's due to come out. I heard that Hancock said later in May. As you say, with that spectrality is going to be absolutely critical, and that's another reason why I think the government will need to start having that conversation with the public about the what's involved, making sure that there are half-time guarantees, that any of our personal data that's collected through that isn't kept any longer than necessary, is only used for purposes of tracing and protecting public health as opposed to for any other reasons. We all need to know if we're going to opt in and trust in this system, what it's going to do with our data and how it's going to be used.
Well, that's another debate coming up. There are so many out there. Munira, good to speak with you. Munira Wilson is health spokesperson for the Lib Dems MP for Twickenham. This is interesting. Alan is West Hampstead. He says the test figures are pure spin. Lies, damn lies and stats. Tests sent out but not tests carried out. And they think the British public are fools. Do you feel the same way that Alan does very strongly, that you've been led up the garden park with this, or would you congratulate Matt Hancock and the government on getting something right? Well over 100,000 tests. Whether it's capacity or actual tests. So you're not delighted with that? 0345 606 0973. As well as that, we'll be speaking about the North Korean leader who has re-emerged, according to that ever-reliable North Korean national state media. More on Kim Jong-un in just a second. Katie Turner has the travel here on NBC.
Thanks, Andrew. The M4 is closed in both directions between junction 5 for Langley and 6 for Slough for roadworks until the early hours of Monday morning. In Romford, a lane is blocked on the A12, that's eastbound at Gallows Corner because of a breakdown. And in Harleston, the traffic lights aren't working on Manor Park
boast advanced features, including a 10-inch digital cockpit and smart assistant systems like lane departure warning. Picture what that Audi looks like. Now think smaller. The Audi A1. It's not a small car, it's a small Audi. Visit audi.co.uk. Audi. Vorsprung durch Technik.
If you want to do something important, work in adult social care. I'm Georgia. I love social care because you never know what each day will bring. The thing that I would say to anybody that was thinking about a job in social care is go for it. We are recruiting in your local area. We need you now, and they need you always. Care for others, make a difference. Today, search adult social care jobs now.
At NatWest, we're putting our money where your business is. We set aside £5 billion of working capital funding for our customers and have already lent over £3 billion to businesses like yours. So if you bank with NatWest and COVID-19 has affected your business, remember, every one of us is here to support you. Search NatWest Business Coronavirus.
Figures for RBS Group. Security may be required. Over 18s only. Subject to status. Business use only. Product fees may apply.
Andrew Castle from LBC.
I have one of these COVID-19 test kits at home now. I would love to know what's the actual deal. Matt Hancock, Health Secretary, said 100,000 tests in a month. He's achieved that, wasn't he? And very happy to give everybody a pat on the back. It was a massive logistical effort. And he said we've got 2 labs up and running now, 3 new mega labs, and scientists and lab technicians, the military, all have contributed. But there's some criticism, I don't know whether you think it's fair or not, some criticism that the counting procedures, the way they count, the types of tests that they suddenly counted with 24 hours to go were slightly different than the way they were counting before. I mean, for me, it's a bit of a moot point. The fact is that people are getting tested now. But if you have had one of these kits, I would love to know what's included. Does it come with COVID-19 test kit written on the outside of it? Who delivers it? How do you swab yourself? How difficult is that? 0345 6060 973. The reason that this springs to mind is that Nicholas Wheel from Chiswick has just texted in. He says, I've received this home test kit and it was missing the swab and the container to return it. Really? So in that way you would say this is ridiculous, and you, government, have sort of pulled the wool over our eyes. But you know, I don't know whether that's a widespread experience or not. But do give me a call. 84850 is the text. 22 minutes past 7. It's Andrew Castle here on LBC. Shall I go through the front pages this morning? Why am I drawn more and more to the FT the older I get? I'm going to start with that in just a second because we'll be speaking to David Buick in a few minutes' time. Now, this is interesting. I think we've seen the digital revolution happen. After 9/11, lots of people said, right, I'm out of the city, I feel there's a threat, I don't want to be around. This time, and it didn't happen because the technology wasn't there and people sort of got back to work. Now this hit people will tell you, this has been the digital revolution, hasn't it? Or at least the start of it, I would have thought. FT weekend, offices set to stay shut for months, working from home, the new norm. You know that sort of sentence people say, could we have had this meeting on an email? Isn't that right? Something like that. Could this meeting have been an email? Working from, I mean, who needs to sit in a train for 3 hours? You're talking about social distancing and how are we actually going to get ourselves around. Well, how about we don't? How about we all stay at home? I mean, can you operate your business that way? More and more of us, it seems, can. Canteens kept closed, no timeline for hospitality, but working from home, the new norm. Jess Staley from Barclays was saying just the other day, do we need this whacking great building which is costing us a ton of money? Do we need it? It's a very good point. The Guardian newspaper this morning, the UK's corona divide, a story that we'll investigate later. People living, this is hardly a surprise, to be honest with you. People living in the poorest areas dying at twice the rate of those in the richest areas. Calls for government to focus health funding on the most deprived regions. Thing is, well, look, it's absolutely too obvious, isn't it? There's about 5, 6 different reasons which remain the case that people's health outcomes, the less money you've got, are worse than those if you've got some dough. I mean, that's, you know, we've always known that. Daily Mail this morning, £5 million mail force, astonishing pledges for PPE airlifts as Camilla donates to it. It's a new fund. It's been driven by the Daily Mail, so they should be congratulated on that. £5 million protective kit for NHS and care staff. That's been their campaign. That's the Daily Mail. Times newspaper: workers face temperature check before leaving home under Johnson roadmap out of lockdown. Well, hold on a minute. Have you ever been on the tube at rush hour? What? And you're going to take a temperature test and then social distance? I mean, sorry, ain't going to happen. So the Times are talking about that. We will. Daily Telegraph: 2-metre rule could be relaxed in exit plan. Lockdown restriction under review as evidence of its usefulness is questioned. So wasn't the WHO original advice 1 metre and they doubled it for ease and to provide a margin for error? Well, either way, 2-metre rule could be relaxed in exit plan. It's a 2-metre distancing scheme at the moment, of course. All right, 25 minutes past 7, Saturday morning here on LBC. Pleasure to have your company. It's just nice to talk to someone. Kim Jong-un has appeared in public for the first time in 20 days. This is from North Korean state media. The KCNA news agency reports that the leader cut the ribbon at the opening of a fertilizer factory. So obviously a magnificent day out for everybody. Some photographs have been published. Donald Trump was asked about the apparent re-emergence of the North Korean leader, and he was pretty evasive.
I'd rather not comment on it yet. Kim Jong-un will have something to say about it at the appropriate time. I don't want to talk about it.
He's great, isn't he? I don't want to talk about it. Lisa Kim is a reporter at the Korea Herald. Hello, Lisa. Good morning. Hello.
Hi.
Hello there. Hi. Is Kim Jong-un alive or dead, we reckon?
Well, as you said, after weeks of worldwide rumors about Kim Jong-un's health and whereabouts, we saw him make his first appearance in about 20 days, and he returned with a big smile. According to North Korea state media, Kim attended a ribbon-cutting ceremony at a fertilizer factory in Suncheon City, which is north of Pyongyang, wearing his trademark black suit on May 1st, which was also Labor Day. And if you take a look at the approximately 20 photos of Kim released by North Korea's official Dodong Sinmun newspaper, he's seen with a big smile at the factory with his top aides and